Morning, Muttu sir. Good morning. Whosoever is there now. Naveen, Krishnan. Last minute they are asking where is the link when I have sent them 3 weeks ago.
Good morning, Binu sir.
Vinu sir may be traveling, going to church.
Binu sir, I'm not able to share my screen, sir.
I will see it. I will see it.
He's there.
सबमिट से बोला ना ये तो सब बेकार सब मतलब बताइए क्या आलू चाहिए
Oh, I see. Swati ji, I see Sandeep. Good morning.
Good morning,
Good
ma'am.
morning, ma'am.
Good morning, sir. Good morning, sir.
Good morning,
Good
ma'am.
morning, ma'am. Good morning. Sir, good morning.
Sir, कैसे हैं sir?
Good morning.
Sir, I am good, sir. How are you, sir?
Fine, thank you.
और सर बताइए आप कैसे हो?
हाँ, fine, sir. Binu sir, I'm not
बढ़िया सर.
unable to share my screen, sir.
Yes, yes, doing that only, sir.
One, sir. Yes, thank you, sir.
अंकल कौन सा कौन का यार कौन कौन अंकल ये चलता
Now try na, Muthu sir. Now you try.
Yes, 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 sir. Yes, sir. Yes. Thank you, sir. Thank you so much.
बैठने देना. The bag of oil.
Is it audible, sir? Visible, sir?
Yes, sir. Audible and visible.
Yes.
अरे आवड़े
ਇਹ ਤੁਹਾਨੂੰ ਪਹਿਲਾਂ ਪਤਾ ਕਰਨਾ ਚਾਹੀਦਾ ਸਾਰਾ ਕੁਝ ਉਹਨਾਂ ਕੋਲ ਸਹੀ ਆ ਕਿਸ ਤਰ੍ਹਾਂ ਕਰਨਾ ਕੀ ਕਰਨਾ ਆਪਣੇ ਉੱਥੋਂ ਆਫਿਸ ਤੋਂ ਜਿਹੜੇ ਚਾਦਰੇ ਦੇ ਉਹਨਾਂ ਨਾਲ ਗੱਲ ਕਰਨੀ ਚਾਹੀਦੀ ਕੀ ਹੈ ਨਾ ਇਹਨੂੰ ਫਲਾਈਟ ਚੈੱਕ ਕਰਨੀ
Vinu sir.
Yes, madam.
Bimla ji just sent a note. They will not be joining us.
थोड़ा बाथरूम
Okay.
एक बाथरूम
If it is time, we can start.
Yes, ma'am. With your permission, if he says, we can start.
Okay. Hello, Dr. Swati ji. Good morning.
Good morning, ma'am. Should we start now?
Muthu sir said something. Getting
Yes, ma'am. Binu sir, again it is disabled, sir. Host. Again, I have shared the screen. Again, it is disabled, sir. Binu sir.
Maybe he is in the parking lot.
Yes. Now is it okay? Is okay. Now I can see that. Yes, Swati ma'am, is it visible, Swati ma'am?
Very clear.
Yes, ma'am. Yes, yes, sir. Yes, sir. Now it is visible.
Ma'am, can we start, ma'am?
Yes, sir.
Swati ma'am, can go ahead.
Okay. Yes. Okay. Okay, ma'am. Okay, sir. So, good morning. Start your day by embracing the beauty around you. Wishing you all the day filled with tranquility of these morning flowers. Like these blooms, let your day unfold and grace beauty. As the sun rises, so the does beauty of these flowers. Good morning to all respected patron ma'am, Dr. Narula Khanna ma'am, and Dr. Binu Joy sir, NSS president. It is my great honor and privilege to welcome you all this special occasion. Today we grace by presence of some truly esteemed individuals who have taken time and out of its busy schedules to be with us. Education is one thing no one can take away from you. As intellectual growth should commence at birth and cease only at death. So here I am Swati Patanwal, assistant professor, Rajki Medical College, Jalon, Urai, was feel privileged to welcome you all for today's session of webinar and for this session. Next slide, sir. Slide change, sir.
Yes, ma'am, it is changed.
It is not visible, sir.
Oh, yeah.
ਨਹੀਂ ਉਦੋਂ ਨਹੀਂ ਹੋਣਾ ਕੁਝ ਵੀ ਰਹਿਣ ਦੇ
Okay, so this is
ਇਹੋ ਠੀਕ ਹੈ
this is my
your speaker is not
file
working
that
please
is
check the
I'm
connection
working
use a different speaker.
administrative. Am I audible?
Yes.
Am I audible? Okay,
Yes,
I'm
you're audible,
currently
ma'am. Please go
working
ahead,
as a professor at
Yes,
the
ma'am.
Rajki Medical College in Jalon. I'm having 13 years of professional experience as published in many international journals and have the authorship of a book at Forensic Nursing and Manual of Midwifery books. And I have reviewed many systematic review and the meta-analysis and also contributed on a newly patent design. And I'm introduced to the founder patron ma'am, Professor Emeritus Dr. S. Narula Khanna ma'am. I'm going to introduce her. Ma'am is a very famed, very have a 45 years experience of variety of settings in teaching, practice, and administrative and management. Madam have published extensively different journals and author on historical perspective in nursing, Indian nursing leaders from 1947 to 2024. The third edition is in printer. Madam has been in a TNI branch president for the 10 years for USA and Canada. Madam has a national representative of TNI and the United Nations for NGO conferences. Patron ma'am has 4 prestigious nurses societies in India, CNRS, NHS, NTI or NSS. Madam worked as a director of nursing in the Gwalior Sophia Nursing College, GNC, and in Jaipur for a Mahatma Gandhi University. Madam worked as a freelance consultant of curriculum development for nursing colleges. I request Madam to give her message.
Next slide, please.
Yes, ma'am.
Yes, ma'am.
Yeah, next slide. Thank you, Swatiji, for your glowing introduction. And respected chief guest, Professor Jyotiji, guest of honor, Professor Dr. Ramandeepji, guest of honor, our NSS founder president, Professor Dr. Binu sir, special guest, Professor Dr. Bimla Kapoorji couldn't be here for unavoidable reason. And special guest, Dr. Ashia. I hope Ashia ji is here, same time as she is in USA, and organizing team, executives, and lovely audience with all our students. Greetings from New York, USA. I am pleased that we restarted and reconnected from where we left and will have very exciting research studies scheduled to be presented by our NSS executives throughout the country. Our guest of honor, Dr. Ramandeep ji, is also a resource person. We will have society's growth conducted by Binu sir for the new NSS members. My best wishes and God's blessings to the presenters. I will join later to read names of the new members. Thank you, Ji. On to you, Dr. MC Madam.
Yes, ma'am. Thank you,
Yes,
ma'am.
ma'am.
Thank you so much. Education is not the filling of pail, but the lighting of a fire. So it's a time for digital lamp lighting ceremony. I would like to call all dignitaries and all joint respected members to.
We are joining.
शुभं कुरुत्वं कल्याणं आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणं आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः.
So here we will start. Thank you all of you. Today is our guest, chief guest, ma'am, that is Professor Dr. Jyoti Katwal, Chapter President, Saffron Chapter, and today's guest of honor, resource person, Professor Dr. Ramandeep Kaur, Honorary Advisor of DICE of Punjab State. And I would also like to thank that special guest today is Dr. Bimla Kapoor ma'am, Senior Advisor, National NSS, and Professor Dr. Ashiya Qureshi ma'am, S&T President of National NSS. Welcome you all, ma'am. And I would like to welcome all our research presenters and may best wishes to all for their presentation. That research is a creating new knowledge. If we knew what we are doing, it would not be called research. If we knew what we're doing, it wouldn't be called research. If we will feel privileged to have you all here today for the session as presenters. And I would like to thank you, that Kuntala Saha ma'am, for the preparing the all presentations and we are contributing on these sessions, and Muthu sir for this very connectivity and all IT section where we work were done by always Muthu sir. That is very technical thing, and it will be always helpful for all of us. So we will proceed to our session. Next slide, please. So here our NSS president, a very great sir, that is Professor Vinny Joy sir, is a gold medalist and currently working as a principal in Rajkot. He has 16 plus years of professional experience and actively involved in enhancing SSS mission, as he is always considering and improving the membership registration. So I motivate all presented members in the session to get registered in the NSS as soon as procedure, and the student membership also get motivated. He has conducted many national and international workshops, has been key proponent of a successful recent international conferences, Vibrant College of Nursing, Surat. He has published many research articles and journals and authored a textbook of pediatric nursing. Sir is a lifetime member in many prestigious professional society on editorial board of Refereed Nursing Journal. He is a pillar of NSS Society. I would like to invite Vinay Joy sir to give his a valuable message on this. Yes, sir. Vinay Joy.
Yes. A very warm good morning to one and all. Respected Chief Guest of the Day, Jyoti ma'am, Guest of Honor, Ramandeep ma'am, our Honorable Advisor ma'am, Dr. Bimla Kapoor ma'am, S&T President, Dr. Ashiya Qureshi ma'am, and of course our patron madam, Suresh Narula Khanna ma'am, all the executives of the Nursing Scholar Societies, and a very warm good morning to one and all. Yes, it's very privileged to whenever this is our 8th webinar series of research presentations. It's very really a learning day when someone shares their research knowledge. It's really great, and I'm very thankful to each one of you who have come forward to disseminate your research knowledge, and really looking forward to hear from you all. I take this opportunity to thank each one of you who have come forward to attend this webinar research series, and hope you will get maximum benefit from the research talks. Thank you all once again. Thank you.
So thank you, sir. Learn from yesterday, live for today, hope for tomorrow. Now it's a time for introduction of our chief guest. I welcome you, ma'am, Professor Dr. Jyoti Katwal, ma'am. Ma'am has completed her BSc from the AIMS New Delhi and PG with CVTS SNDT Mumbai, certificate in palliative care, diploma in naturopathy, yoga, trainer, simulator-based education, addition for the doctorate in nursing. Dr. Jyoti ma'am has 20 plus years of professional experience with a variety of settings, and Madan currently, madam is working as a principal at GMCH College of Nursing. She is the president of our NSS Saffron chapter in Chandigarh. Madam has awarded Nursing Ratna Award in 2023 by NTI Commendation Awards of Best Service in the COVID-19 pandemic time. Active researcher, Best Paper Awardee, and the more she has attended, participated in workshops, conferences, local, state, national, international, and also received the first prize in the ECG interpretation and wound care edition in appreciation certificates and medical relief education camps. Punjab DEO Education Innovation and National Institute of Disaster Management, currently involved in e-learning programs and organizing national international CNEs. Her research articles are published in Referee Journal, has been contributing the nursing profession. She is the member of TNI, Asian Nurses Association Scholar, INH and NTA, Society for Nursing Practice. So I personally also knowing that Dr. Jyoti Katwal ma'am, I will be a contributor for her newly inaugurated book, that is Skill Procedure, and she is very nice. So I would like to call Dr. Jyoti K ma'am for her message. Yes, ma'am. Jyoti ma'am.
Swatiji, we can proceed.
Yes, ma'am. Okay.
Her dad is.
So maybe ma'am will be in some connectivity issues. So we will be proceeding. So education is not a preparation of a life, but education in life itself. So now I would like to welcome our resource person, that's guest of honor. Next slide, please. Professor Dr. Ramandeep Kaur, ma'am, honorary advisor of the NSS, Punjab State. Madam has completed her BSc Nursing MSc for the CMC Ludhiana Vellore, CMC Ludhiana, and PhD from Deshbhakt University. Dr. Ramandeep ma'am has 20 plus years of professional experience in variety of settings, and madam currently working as a principal at the Ajit Nursing Institute, Suman. Madam achievement includes external practitioner as a practical exam and exam coordinator, superintendent, paper setter, dissertation, thesis evaluator, and she has also participated in the conference, local, state, national, international levels, published many journals and contributing to nursing profession. She is a member of NSS, TNI, NTI, NRSI, Punjab Science Congress, Indian Society for Psychiatric Nurses, or UIJNR. Award included Sarla Kapoor Award for the Best Paper Presenter in Indian Society of Psychiatric Nurses, Best Professional Skill in the Nursing Education Proficient by Friendship Forum. So I invite Dr. Ramandeep ma'am for her message. Ma'am, Ramandeep ma'am.
Are they having a link problem or?
Ma'am, what is the issue, ma'am?
Is she on? I don't see.
Yes, slide link message is visible, sir.
No, why Madam Ramandeep Madam is not there?
Must be something because everyone cannot be absent.
Yeah, that is true, ma'am.
Is there? I think the link is a link problem.
No, Ramandeep ma'am, she is not there, ma'am.
Okay, in the meantime, I will check. You proceed.
Yes, ma'am.
So we will proceed towards our today's special guest, Bimla Kapoor ma'am, as a respected RN lady ma'am. Dr. Bimla Kapoor ji is a sister national advisor. In addition, also gracing a senior nursing advisor in the CNRS, and she has a 55 plus years of professional experience in variety of professional settings. She is a pioneer of the distance in the nursing as national and international levels, has been chairperson of expert in National Nursing Bill Committee with Ministry of Health and Family Welfare and Government of India. The bill is now in a new law. Madam has published extensively, authored reinforced psychology for nurses, which is still held on key to study against skill rendering quality care for the patients. Inviting Ma'am Dr. Bimla Kapoor ji for her message blessings.
She just messaged she's under the weather, cannot attend.
Okay, ma'am. Okay. Next, we can proceed to our Ashia Qureshi ma'am. Today is our guest, special guest. Ashia Qureshi ji ma'am is a well-known nursing leader. She is a publisher and expert researcher. Ashia Qureshi has been associated with the Galgotia University since 2014 till 2021. After rendering 45 years of experience at AIIMS, she has to her credit professional experience of over 50 years. Completed her PhD in public health. She is also an MBA from Modern Institute of Management, Newport
Close, madam.
University. She has joined AIMD in the year 1972 and retired after superannuation in the year of 2014 October. Worked at the various capacity as a PHN with the WHO project. Clinical nurse, educator, administrator, research at AIIMS. Her area of interest includes community health nursing, nursing education, nursing administration. She has to credit more 30 research publications in national and international journals. As we see for the award, she has been awarded for the Mahila Shiromani National Award from President of India in 1995 for the Best Community and Patient Care Services. Rajiv Gandhi Excellence Award from NRI Society of India in Delhi. So I would like to call Lifetime Achievement of the during International Nursing Conference in 2017. Legendary Mother Teresa Award from NRI Society presented Lord Swaraj Paul 2019. Lifetime Achievement Award from the Nursing Scholar Society 2020. Life member of the 20 professional bodies of TNI, NRI, NSSS, PHI, World Population Geriatric Society, Global Health Conference, USA, and many more. Participated as a resource person in the 50 plus conference of national and international, and member in the various universities. Selection committee members, edited journals and many books, completed Vijayani HRM and TV certificate program for 6 months out of Nepal, Swayam with the Gold Award. Secretary NSS NCR chapter, NSS Joint Advisor at HQ level, NSS Advisor for J&K chapter. Chairperson for the India Nursing Conference 2022. So I would like to welcome Dr. Ashia Qureshi ma'am ji for giving a message.
No word from her too. Till yesterday, everybody was okay.
Yes, ma'am.
Yeah.
Today nobody is there.
Yeah. And go to next. We can fill in between if they come back.
Sure, ma'am.
So I would like
Swati
to
ma'am.
now they're proceeding towards yes sir. Yes sir. Sir, am I audible?
Yes, ma'am.
Am I audible, sir?
Yes, ma'am. You are audible.
So I would like to introduce our master of introduction of our today's second session master of ceremony, Muthu sir, Dr. Muthu PC. He, sir is the president of our NSS 4th CR chapter 15 Karnataka. In addition to doctor degree, along with he has completed MSc Community Health Nursing and MBA in Hospital Administration. He worked as an NED consultant and as a clinical auditor, as he has a certified of 10 hospitals for the NABH entry level. He has received many certificates and awards, published many articles in referred journal. Training of the trainers, courses in the midwifery faculty development program from NRSC New Delhi. He is certified of internal assessor for the Kayakalpa NQAS
Muskan.
Muskan Lakshya program, Sigma, green belt, yellow and black belt. Sir is a life member of many nursing associations and society as an NTI, DNI, NSS, NHS, IPF, NSC, etc. He is a certified master's trainer of the simulation-based education from NRSC New Delhi. He has organized national and international webinars. I invite Muthu sir to continue second part of the Master of Ceremony on to you, sir. Thank you.
Thank you, ma'am. Thank you for first Master of Ceremony, and thank you for my introduction. Respected dignitaries, good morning to all. Respected dignitaries, Dr. Suresh Narula Khanna, ma'am, veteran ma'am. Respected chief guest, today's Professor Jyoti, ma'am. Guest of honor, Professor Dr. Ramandeep, ma'am. Guest of honor, our Miss Professor Benu, sir. Special guest, Professor Bimla Kapoor, ma'am. And another second special guest, Dr. Ashiya Qureshi, ma'am. And the eminent speakers of today's events and as member of all the participants. It's my honor and pleasure to be here as a guest of honor and master of ceremony in this research presentation series. Nursing research has a tremendous influence on the current future professional nursing practice, thus rendering it is an essential component of educational process. This research presentation series are providing opportunity to the students, clinical nursing personnel, and faculty members and the budding nurses to gain knowledge from their nursing leaders and disseminating and utilize their research findings in the different areas. I would like to thank respected Dr. Khanna ma'am for initiating and providing the platform to nursing professionals to disseminate their PhD work with others. I wish to all our today's research presenter that your productive work will be utilized by the individuals and the society. This is the brochure and these are today's introduction of first presenter, Professor Dr. Karuna Sharma ma'am. Dr. Karuna ma'am has a 22 plus years of professional experience in a variety of settings and currently working as a HOD cum professor in SGIT College of Nursing, Mehta Road, Piola, Amritsar, Punjab. Madam is a member of various committees and chairpersons of some of the additional to in the role of observer, evaluator, inspector and resource person, etc. Madam has attended and participated in workshops, many workshop conferences at local and state and international and national levels. And her research articles are published in several journals, has been contributing to the nursing profession through Punjab Nursing Council. Madam is a member of SOMI, NSS, NTI, TNI. I invite Dr. Karuna ma'am for her research presentation. Over to you, ma'am. Dr. Karuna ma'am. Dr. Karuna ma'am.
Karuna madam is there actually. Even
Yes, sir.
Jyoti madam has also joined. So by
Yes, sir.
that time we can get Karuna ma'am. Jyoti madam is joined.
Okay, why don't we invite her for her message?
Yes.
Yes, ma'am.
Yes.
Now I invite Dr. Jyoti K. ma'am for her message. Jyoti ma'am.
Good morning, everyone. It's pleasure to join, though I have some family issues, but I hope I didn't miss out anything. Thank you so much for involving me in such a scholarly event. And as our society has been working dedicatedly to improve on different aspects of nursing research. And I am thankful to Dr. Su Khanna ma'am for involving me. Thank you so much, ma'am, and Benu sir and his team. I would say thank you very much for involving me. It's just I'm involved into many things. That's why I'm not getting words to speak what to say. Message from my side is that as we are working on nursing research and talking about different projects that we have done, and today also we have 2 presentations, and I feel that all these activities are definitely improving the body of knowledge of our profession, and when we bring these research into the implications and into our daily practices, then our standards of care would definitely improve and quality of care will be standardized. Thank you so much, everyone. And it's pleasure to be part of this event. Thank you.
Thank you, ma'am. Thank you for your blessings.
Back to Karnaji, if not.
Now I call Dr. Karuna ma'am to present her research proposal. Dr. Karuna ma'am.
Hello, good morning, sir.
Yes, ma'am. Is it
Okay, sir.
Is it visible, ma'am?
Yes, sir.
Yes, ma'am. Ma'am, you can share your screen, ma'am. I'll exit.
Okay, sir. Okay.
You can share your screen, ma'am.
Okay, sir. Good morning, sir.
Good morning, Karnaji.
Sir, ma'am, slides are visible?
No, not yet. Did you share the screen? You have to push that button, share the screen.
Okay, okay, ma'am. Go back.
Or send the PPT to Muttu sir, he can play for you.
Okay, ma'am.
Whomever you can send it soon, or send it to me, I will forward.
Okay, ma'am. Okay.
In the meantime, I can introduce Dr. Pratibha ji. We are so happy to have her, and she is already just think in all the activities I have asked her, do this, do that, be chairperson or here and there. She said, yes, ma'am, I will do. And even she is ready to present in our October, that webinar number 9 series. Thank you, Ji. Welcome. Say something. We are hearing.
Yes, thank you, ma'am. It is so good to get connected with the Scholar Society and especially Dr. Narula. It is so good, having you and me, being in this society and part of this society, getting connected with you all. I feel it is my proud privilege. Also, thank you for giving the opportunity to present also, and because it is really a missed opportunity, because my PhD paper I haven't presented anywhere, neither I have published, because there was a very long gap, and then long gap for conducting the exam from SNDT University. So the data collection and this got such a big gap. So I couldn't publish anywhere, neither I couldn't,
That's all right.
send. And then you have given the opportunity, so I'm so glad. And I have used Solomon 4 group design, which is a rare design which is used by nursing fraternity. So once again, I'm so thankful to you.
Wonderful. Welcome again. Did
Thank
you, Kiran, she sent you PPT, Muttu sir? Unmute. Unmute.
It is visible, ma'am. I think Karuna ma'am only has shared a screen. It is visible.
Oh, okay. All right.
Karuna ma'am,
Good.
is that also?
Shall I start, ma'am?
Is okay, ma'am. Is that okay, ma'am?
Okay. Good morning to everyone. So my research statement is a study to develop self-instructional module on umbilical cord stem cell collection, preservation, and utilization, and evaluate its effectiveness on improving the knowledge of operational level nurses in the selected hospitals of Amritsar, Punjab. Shall I read, sir, introduction?
Yes,
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 ma'am.
please, ma'am, please.
Okay. Umbilical
Keep on
cord is
going. Keep on going.
okay, ma'am. So next one is the objectives of the study. To assess the pretest knowledge on umbilical cord, blood stem cell collection, preservation, and utilizations of operational level nurses. Then to assess the post-test knowledge on umbilical cord, blood stem cell collection, preservation, and utilizations after implementation of self-instructional module on operational level nurses. To evaluate the effectiveness of self-instructional module on umbilical cord, blood stem cell collection, preservation, and utilization by comparing pre-test and post-test knowledge of operational level nurses. So next one is that to find out the association between pre-test and post-test knowledge scores of operational level nurses with their selected demographic variables. So next one is hypothesis. So hypotheses were tested at 0.05 level of significance. So the research hypothesis, the mean post-test knowledge scores on umbilical cord, blood stem cell collection, preservation, and utilization among operational level nurses was significantly higher than the mean pre-test knowledge score. So as to there was significant association between the mean pre-test knowledge score on umbilical cord, blood stem cell collection, preservation, and utilization among operational level nurses with selected demographic variables. So next one is a review of literature. Skip, sir, or continue? Can I skip, ma'am?
Just spend only 1 to 2 minutes on
Okay.
each of these.
Okay. So review of literature is also related with the knowledge regarding umbilical cord, stem cell, and blood bank. So second one is the literature related to time of collection, preservation, and utilizations of umbilical cord stem cells, and literature related to effectiveness of the self-instruction module. So these are the review of the literature. Next one, the schematic representation of the research study. So the pre-experimental design chosen for the study is as prescribed in the table. So first one is the pre-test, like self-administered or structured knowledge questionnaire on day 1. After that, intervention is the self-instruction module on day 1. So next one is the after the 7th day, so self-administered or structured knowledge questionnaire after the 7th day. So this is the flow chart of the methodology. So first one is the research approach. So quantitative research approach, research design, pre-experimental 1 group, pre-test and post-test design, research setting, SGRD and GMC Hospital, Amritsar, Punjab, target populations nurses, and accessible populations are operational level nurses of SGRD and GMC Hospital. So sample size were 400 nurses. So the sample technique is purposive non-random sampling technique. So next one is the information given to the nurses. Written consent was taken. So pre-experimental group was 900 nurses, for 400 nurses. Then pre-test conducted by self-administrations or structured knowledge questionnaire to each nurse. Duration of 30 minutes was given for each sample to complete the tool. So on the same day, self-instructional module was administered on the umbilical cord stem cell collection, preservation, and utilization. So after the then post-test on 7th day using the same structural knowledge questionnaire on the nurses. So analysis and interpretations of the data. So inclusion criteria was male and females of the age ranges 21 above 35 years, and operational level nurses was to participated in the study. So operational level nurses working in the selected hospital. So exclusion criteria, so who have been previously sensitized. And the research tool was socio-demographic data part 1 and part B self-administered knowledge questionnaire part B. So then pre-test was on first day and post-test was on 7th day. So next one is the results of my study. So first table shows that majority of the nurses were in the age group of 21 to 25 years. That was 69.2%. So according to the gender, this table shows more than half of the nurses. Sorry, so gender, this also shows that more than half or 96.2% are the females. And in the habitat, this table shows that 55.2 are related with the urban area. So next one is the professional qualification. So in the professional qualification, more than half of the nurses were general nursing midwife, that were 58%. So post basic Bachelor of Science nursing are also less, that is the 30.8%. So for the job experience, so maximum experience of the nurses 0 to 2 years, that was 55.8%. So next area wise, so area wise minimum nurses are 42.0%. So according to the mass media, 36.8% take the knowledge from the television. So next findings related to the pre-test and post-test knowledge of operational level nurses on umbilical cord, blood stem cell collection, preservation, and utilization. So the table shows that 46.5% nurses had the average knowledge in the pre-test, and in the pre-test, and 50.75 nurses had the good knowledge in the post-test. So in comparison, this table shows that overall level of knowledge and chi-square was applied, and value was 4.17, degree of freedom 3, and P less than 0.0001, that was significant. So this is evident that after the administration of SIM, nurses had significantly improved their knowledge. So next table was pre-test and post-test knowledge score among operational level nurses regarding umbilical cord, stem cell collection, preservation, and utilization. So out of the maximum score 30, the knowledge score ranges from 0 to 25 in pre-test and 14 to 30 in post-test. So mean was 14.93 in pre-test and 23.36 in post-test. So SD 4.7 and post-test 3.32 in post-test. So mean percent was 49.77 in pre-test and 77.87 in post-test. So mean difference was 28.10. So next one is the comparison of overall pre-test and post-test knowledge mean scores of operational level nurses regarding umbilical cord stem cells collection, preservation, and utilizations of. So there is statistically significant difference between the pre-test and post-test. So paired t-test was applied and 3 of the t-test, like t less than 0.001, it means this is the significant. So next table is association. So association of pre-test, so there was no significant association with the socio-demographic variables. So next table shows association of the post-test knowledge of nurses. Like table shows that there was no association with the selected demographic variables. Only age and experience were association with the post-test knowledge score of the socio-demographic variables. All other variables are no associations. So next one is the major findings of the study. So majority of the operational level nurses was in the age group of 21 to 25 years. So maximum of operational level nurses was 96.2 were females, and majority of the subjects means 2 to 1% belongs to the urban area, and on the basis of qualification, half of above the nurses 2% were having general nursing. So allocation on job experience, half of above of the nurses, that is 2 to 3 means 55.85% were having job experience up to the 2 years. So in the lieu of previous experience, 168.42% operational level nurses were in the maternity ward. So on the basis of exposure to mass media, 3.6.8%. So it was found that 46.5% had average knowledge, and after the same 203 had excellent knowledge of the operational level nurses. So it means mean differences of the pre-test and post-test knowledge score was 28.10%. So it was found that statistically highly significant difference between the pre-test and post-test knowledge score. So, and this is evident that SIM is effective to improve the knowledge of operational level nurses. So thus hypothesis that means post-test knowledge scores on umbilical cord, blood stem cell collection, preservation, and utilization among operational level nurses was significantly higher than the mean pre-test knowledge score. So it was found that statistically there is no significant association with the pre-test knowledge score of the operational level nurses with socio-demographic variables at P less than 0.001. So statistically observed, there was a significant association between post-test knowledge score of operational level nurses with age and experience at P less than 0.01. So it was found that statistically there was
I request all the participants, all the delegates, please mute yourself. Please.
Mousse आंटी बोलिए mousse chocolate mousse है आपके लिए I take later. Okay, I'll put it.
So next one is the implications. Nursing practice, they were present at the time of delivery or cesarean, so, and can play an important role in umbilical cord stem cell collection.
उसमें कर लो, आपकी प्लेट में कर लो ना। ये नॉर्मल है।
Sir, is it audible?
You are mute, but other people should mute. Yeah, go on.
Okay, sir. Okay, ma'am. Okay, thank you. So nurses are key persons of the health team who play a major role in health promotion and maintenance. So next one is the nursing education. So the present study emphasis on enhancement in the knowledge of staff nurses on umbilical cord, stem cell collection, preservation and utilization through structured teaching program also. So education, healthcare professionals, especially staff nurses, can remove misconceptions and improve their knowledge. So nursing administrations must prepare and coordinate an education program for the nursing staff in order to keep their skills up to date. So nurse administrator must be capable of organizing program that provides information on collection, preservation and utilization of stem cell collections. So nursing research. So nursing research should be directed for exploring and updating the nursing personnel knowledge regarding umbilical cord, stem cell collection, preservation, and utilization. So next one is the disseminated result through the conferences, lectures, seminars, international journals, and as well as website. So next one is the recommendations for the future research. So the study can be replicated on a large sample to validate and generalize its findings. So similar study can be undertaken with a multi-setting approaches. So this study can be undertaken in hospital setting to have two pictures. So more and more research should be conducted in order to develop more innovative strategies to improve the knowledge of operational level nurses regarding umbilical cord, stem cell collection, preservation, and utilization. So the conclusion of my study. So the overall findings reveal that there was increase in level of knowledge among operational level nurses after administration of the self-instruction module, which was statistically significant at the level of P less than 0.05. So hence it can be said that SIM was effective based on this. Mostly nurses will involve how to collect, preserve and utilization of the stem cells. So
Thank you, ma'am. Thank you for your wonderful research session, ma'am. Before going to feedback, I would like to take opportunity to call Dr. Ramandeep, ma'am, today's resource person and guest of honor actually. So she's supposed to be. Ma'am, I take this. Yes, I'll change.
She has to stop sharing the screen.
Yes, ma'am. I have changed it, ma'am.
Okay. Okay. Wonderful. Got it.
I request Dr. Ramandeep, ma'am, to give her message. Over to you, ma'am.
Yeah, thank you very much, Mr. Muthu. First of all, good morning to all the dignitaries. And especially, I am very much thankful and feel honored to be here as the guest of honor to celebrate the pinnacle of intellectual curiosity and scholars' excellence. Moreover, I am very much thankful to providing me this opportunity to Madam Sue Khanna, who is the brain and mind behind the Nursing Scholar Society thought and establishment, and to flourish it. Am I audible?
Yes, ma'am.
Yes. Okay. Then, secondly, I must say thank to Mr. Vinu Jo, who is the president of Nursing Scholar Society. And beyond this, there are some eminent personalities of the nursing profession Madam Aisha Qureshi is also here. And Madam Bimla Kapoor, who is, I think, so the available and most, I can say, advisor for the Nursing Scholar Society. And I am reading her name everywhere in every event. So this research event represents the best of human integrity, showcasing innovating solution to the pressing all the nursing challenges. And excuse me. Moreover, this is a very good platform to provide all the device scholars as well as to the other scholars, who research scholars, who may find the platform to represent and to share their research findings with us, so we can also enhance our knowledge and enlighten our research aptitude with their findings. Again, once again, thank you so much to all the organizers and the NSS team. Thank you very much.
Thank you, ma'am. Thank you so much, ma'am. Thank you for your blessings. Now I take this opportunity to call our SNT President, ma'am, Dr. Aisha Qureshi, ma'am. Ma'am, please give me your message, ma'am, for today's session, ma'am. Over to Aisha Qureshi, ma'am.
Yes. Hello, everyone. And good morning, Dr. Khanna. I'm so sorry that I started it late, joined late because I was out and there was a network problem. So I'm really sorry. And it's a beautiful and nice program. I've heard the presentation now, which was done by the candidate, by the, researcher. She has spoken it so well. And this platform is really providing us a lot of knowledge. And this is, again, everything goes to our the highest leader and our pattern madam, Sue Khanna madam, she has started this research presentation, and whole of the team. NSS is a family. We are very happy to be in the family, and everybody is cooperating with each other. This is a, best thing which I like, and it's expanding day by day. Our mission is to expand it to that level that, it is people will say, wow. So we are going to reach to that stage, and I'm really, honored to be invited as special guest by our patron madam and the team. And I congratulate to all the researchers who have presented and who are going to present, the research studies and all. And I think everybody likes this type of activity, among all that, because this is called the Scholar Society. So we are all scholars here and learning day by day. We are still learning. We are all in a stage, the learning starts from womb to tomb, So we are all learning. Thank you so much. Thank you, everyone. Thank you for the NSS family and Dr. Sue Khanna.
Thank you, ma'am. Thank you for your blessings, ma'am. Now I will go with the feedback of first presenter, Dr. Karuna ma'ams. Ramandeep ma'am, Dr. Ramandeep ma'am, anything you wanted to add, ma'am, for the today's first presenter?
Yes, please. Dr. Karuna has presented very beautifully, and a very tailored presentation is there. And this knowledge regarding the stem cell banking, it is really, really a need of the hour for the society and to all of us. And I must say congratulations to Dr. Karuna to do such a beautiful research, to select such a beautiful research topic. And I think so there is nothing to say, because her findings are really very good.
Yeah.
Congratulations,
Thank you,
Dr.
ma'am.
Karuna.
Thank you. Thank you so much.
Well done.
Khanna ma'am, anything you wanted to add, ma'am?
Carry on, carry on. Asha ji wanted to say something.
Yeah,
Asha,
I heard half of the, discussion about this research. So it was the findings, I listened the findings. The findings was were very appropriate. And I think this study can be done, on larger sample, so that we can, do it little more at a higher level. The sample size was little smaller, so I think this has to be done on the larger sample so that we can, spread the findings and all. It can be applicable. Thank you so much. Nice,
Thank you,
Karuna ji.
ma'am.
Nice to present.
Here in these
Thank you,
Western countries, they are putting a lot of effort and importance because they are using it from shampoo to giving to the as a stem cell for those who need it. So I think this was very appropriate. And
Very
as
appropriate.
you said, we can go for the broader aspect and broader research.
Thank you, ma'am. Thank you so much. Binu sir, anything you wanted to add, sir? Jyoti ma'am? Thank you. So I'll move to second presenter. Today's our second presenter. Introduction of second presenter, Professor Dr. Anjali Muthukumaran. Anjali Kumar ma'am has a 17 plus years of professional experience in variety of settings and currently working as a vice principal and principal professor at ERA College of Nursing. And madam have done a short course on NABH, BLS, ECLS, PALS, pain management, blood pathogens, first aid, EMR, CPR, AED, BLS, ACLS, LPN, code of ethics, medication error, so and so on. Madam is a member of various committees and chairpersons of the SUM. In addition to her role, observer, evaluator, inspector, resource person, etc. Madam has attended, participated in many workshops, conferences, local, state, national, international levels. Madam has been awarded with the Corona Warrior, IEGA, Best Administrator, IW Leadership, Prestigious Scientist Award, RGA Award, Nursing Award, Bharat Shiksha Gaurav Puraskar, International Leader Achiever Award, World Educator Conclave in 2022, and Virtual Edition 100 Highly Effective Teachers Professional Principal Award 2022. Business Leadership Summit Award, Global Teaching Excellence Award, World Leaders Achievers Conclave, International Conference from Challenges, Role of 21st Skills and Values Inclusions. Asia's biggest fest and conference icons of ICF, Powered Shiksha Ratna Samman Award, Rashtriya Pratisha Award, Global Educator Excellence Awards in 2022. And her research articles are published in referred journals and has been contributing in nursing profession through the Punjab Nursing Council. She is a member of UJRS, CNRS, International Researcher, NSS, INSC, TNAI, NRSI, SOCHIN, SOMI, IRCS, IAPH. I invite Professor Dr. Anjali ma'am for her research presentation. Over to you, ma'am. You can
Thank
share
you,
the
sir.
screen,
Thank
ma'am.
you. Yes, sir. I share to ma'am, sir. Kanna ma'am.
Hi.
You have shared, ma'am.
Thank you, sir. Thank you so much for your introductions. It's a very warm welcome and good morning to all of us, dignitaries, resource person, and guest of honors and organizing team. For all, I prepared one quotations. Education gives you identifications. Experience gives you knowledge and practice. Based on these quotations, I can move for my presentations. I thanks to Ma'am Kanna Ma'am and the President Sir Binu Sir for giving opportunity and meet for all the platform expert and emirates of this sessions. Really, I thankful to God and as for all the dignitaries for giving this opportunity for moving for today PhD scholar presentations. So I'm very happy to meet all and today this platform also. Thank you, sir. Thank you so much.
Welcome.
Yes, ma'am.
getting there?
Yes, ma'am. Muthu
Good.
sir, can you slide share?
Yes, ma'am. Is it okay? Yes, ma'am. Yes, ma'am. Is it visible, ma'am?
Visible, sir.
Yes.
It's not in
Is it
slide share, sir.
visible, ma'am?
Yeah, slide is not visible.
Now you see, ma'am?
Yeah, now we
Yes.
can see. Yeah.
It is slide share, ma'am.
Yes,
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 sir.
it
Yes.
is there.
Not visible.
Yes, sir. Visible, sir. Now.
Yeah, you can start now.
Yes, ma'am.
We
Yes,
can start,
ma'am.
ma'am.
Yes, ma'am. A statement of the study to assess the knowledge of
Yes,
staff
ma'am.
prevention and management of perineal tear during normal delivery at selected hospitals with a view to develop self-instruction models under the guidance of Dr. Rajendra Prasad, sir. Next slide, sir.
Yes. Ma'am, is it visible?
But not readable.
It's blurring, ma'am. I think.
Yeah. I think internet problem.
Yes,
Might
ma'am.
be, ma'am.
Yes, in
For a while, it may get clear.
so bodily wound or damage is referred to the trauma is one of the injury that may occurs during vaginal delivery is a genital trauma. It's include vulva, vagina, perineum, cervix and uterine trauma or injury. During delivery of the perineum, vagina and uterus and their supporting tissues are sustained to majority of acute injury and laceration for the mothers. Motherhood is a process nature has bestowed on the woman with the ability to procreate to the society. She must go through the extremely grueling and labor procedure for this process. So either it will be the vagina or in the abdomen, child may be delivered. 99% of deliveries happen vaginally, so which is referred to the normal labor. So normal labor delivery is a sequence of occurrence that the part of mother womb with the goal of ejecting the living embryo through the sac. So this procedure is involved expulsion of cord from the mother uterus and placenta and fetus. This technically very crucially we can take care as a nursing officer to follow for prevention of complication and injury to the mothers. Next slide, sir.
Yes, ma'am. Is it
To
okay,
minimize,
ma'am?
yes, sir, it's visible now. To minimize perineal laceration, a nurses should manage head delivery throughout the labor and deliver by preventing early head extensions and spontaneous forceful head delivery. Delivering head is between contractions and episiotomy in a timely manner. Care during abnormal presentation like bridge presentation, shoulder presentation, footling presentations, forceps delivery, vacuum delivery, etc. Next slide, sir.
Yes, ma'am.
Because of the perineum is a muscular region, it may be easily be stretched during delivery to allow for expansions and baby head passage through the channel. To allow for simple expansion during delivery without ripening the perineum, the perineal tissues must be more relaxed and extensible at this time. Lacerations of the perineum may occur during normal delivery due to the fast and abrupt ejections of the head. This is very common in primigravida mothers. Next slide, sir.
Yes, ma'am. I have moved it, ma'am. It's a network issue.
Yes, yeah. There are 5 types of tears are there. First degree for superficial tears is involve the skin of the perineum and the tissues around the opening of vagina or outermost layer of the vagina itself. But no muscles involved in this. Second degree, tears and laceration extend beyond the forehead and perineal skin and vaginal mucosa to perineal muscles and fascia, but not in the anal sphincter. Third degree, the tears of third degree may be further subdivided into 3 categories. The third degree A is a partial tear of external anal sphincter involved less than 50% thickness, and B and the greater than 50% of external anal sphincter, and C is the internal sphincter is torn. So this is a degree usually take place during normal delivery because of is not proper practice on the normal delivery. And fourth degree is a fossette, perineal skin and vaginal mucosa, muscles and sphincter and rectal mucosas are involved. Bottom, the tear is whole. Buttonhole tears is type of perineal injury occurring during vaginal delivery, which is involved the rectal mucosa and intact anal sphincter. Next slide, sir.
Yes, ma'am. It's moved.
Next one, sir.
Yes, ma'am. It will come.
Yes. Need of the study, the perineal tear is extremely frequent during childbirth, occurring of women during first their delivery and about 20% subsequent deliveries. Any laceration that extend beyond the perineal skin and subcutaneous tissues must be considered as an obstetrical problem for mothers. Genital injury during may occurs accidentally as a lacerations and purpose of episiotomy between women experience for trauma, which may result in perineal pain, incontinence, sexual difficulties, and other short-term, long-term morbidity, and vary degree of functional impairment and day-to-day activities of the mothers. Next slide, sir.
Yes, ma'am.
Global scale, the Australia ranks as well. It comes conducting episiotomies, gives the United States episiotomy rates is presently 35%. In some Latin America countries as well, in Taiwan and other episiotomy routinely performed is the first time mothers with the rates of 90%. For based on this only, when we plan to do with the proper practice knowledge in this area, so we'll also 99% of mothers to care on during normal delivery. Next slide, sir.
Yes, ma'am.
Statement of the problem. The study to assess knowledge of staff nurses regarding prevention and management of perineal tear during normal delivery at selected hospital of Lucknow with a view to develop self-instruction models to know updated knowledge and practice properly in the labor room. Next slide, sir.
Yes, madam.
Objectives of the study to assess the knowledge of staff nurses regarding prevention and management of perineal tear during normal delivery. And second objective to find association between knowledge regarding prevention and management of perineal tear with the selected demographic variables. Next, please.
Yes, ma'am. Hypothesis.
Yes. And hypothesis 0, knowledge score is staff nurses terms perineal tear had, there is no significant relationship with the chosen demographic factors. And H1, the knowledge score of staff nurses in terms of perineal tear, some significance of demographic factors have the strong relationship between knowledge and practice. Next slide, sir.
Yes, ma'am. Limitations.
Yes, a staff nurse is working selected hospital as Lucknow, and staff nurses who are willing to take part in the research project is taken, and staff nurses who is willing present during the research we taken of. Methodology is a descriptive research approach was used in the study. The research designs selected in the present study was non-experimental and descriptive research design, and variable is demographic variables too. Setting, pilot study was done in Unity Hospital, Lucknow, and main study was carried out Eras and KK Hospital in Lucknow. Populations, target population is staff nurses working in selected hospital. Sample size is 250 staff nurses. Sample technique is purposive sampling technique. Section 1 is consider information about demographic variable of staff nurses. Section 2 is a structured knowledge questionnaire which is include question that assess for the perineal tear and prevention and management base. And then validity, the dual validity was analyzed by the 11 experts, including medical and PhD other statisticians. And tool is reliable for this study. We was checked by the split half method. Calculate the value was 0.8. It is a accepted value for doing this study. So we the research is reliable for our study. The conducted in Unity Hospital. Sample that pilot study was conducted in Unity Hospital. Sample size is 25. Finding is satisfaction significantly. The reliability 0.8. So we further started for study. Main study was carried out in Era Lucknow Medical College, KK hospitals. The sample is 250 and data analysis was used in this studies, descriptive and inferential statistics. Next step.
Yes, madam.
And analysis and interpretation, there are 3 sections we assessed. Section 1 is description of demographic variable of the staff nurses. Section 2 assess the knowledge level of staff nurses regarding perennial tears. And section 3 association between knowledge of nursing staff nurses and demographic variable regarding the perennial tear. Description of demographic variables of staff nurses is age verification. There are 44% for 31 to 40 years. People are more in this. It shows for the ages variables. Next, sir. And 26 and gender variables is mostly, it shows for 52% for the males and 48% for the females. Variables shows in the studies. For educational qualifications, GNM score for 30% of this. Post BSc nursing officers having 26%, and BSc nursing officers having 36%, and MS is having for 8%. Based on this, we have the most score on this BSc nursing, 36% for variables. And work experience, there are 5 to 15 years are having 44%, and for less than 5 years having 22%. And 16 to 25 years are having 20% of there, and more than 25 years are having 14%. It's more significant for 5 to 15 years are having 44% of work experience of overall. And work experience in the labor room, they have 5 to 15 years are having 46%. For more and more exposed and practical and experience it shows for the area. Next, sir.
Yes, madam.
And previous knowledge scores in this, they have the 56% will have the S and 44% having the no. So repeated experience and works is shows it's more effective for this study. Yes, next slide, sir. Area wise of level of score of nursing staff nurses is shows. And educational qualifications and work experience and experience in labor room and previous knowledge. It's always 4 factors are significant to this study, and age and gender is not significant to goes more for that. And recommendations, the study was we can extend broad level of operations because now leading MMR is a leading one of test for in all the area. So better we can give more population and more area. We are doing repeatedly and we are managing with the information booklet and we are giving checklist and for the trained persons to observe. We are follow, it will get for effective feedback. To assess efficacy of this planned educational program, it's a comparison study we can perform it. And similar study can conduct in the community setting also because PHC, CHC and Health Wellness Center is leading. So there is not that much experience. Better so those person is experience and especially for graduate and with a standard and policy and guidelines those well known and practice as for that is a better outcome will comes in the community setting. An experimental study we can carry it out under the control group. So we can do quality study also we can do it. Selected area we can take, we can evaluate it each and every parameters under this study also. The conclusion of this study, I came to understood after doing this study, Better if we can place for MSc level and a special practitioner for midwifery, posting in the labor room. Under them, those who are students and nursing officers, it's the work means it's a more effective. I felt based on my study because every person is not updating the knowledge and leading for guidelines and policy. For that, if an expert person is posted in the area under the supervision and guidance, if we carried out all the nursing officer and nursing assistant, those who are working or midwifery or skilled birth attendant, wherever is posted, every person under the supervision, if we carry it out, if 100% we can make the mothers without harm for the normal delivery, and it is a smooth manner also, and we can fear out for mothers coming very painful delivery also we can choose. Thank you, ma'am. Thank you, sir.
Ma'am, thank you for your elaborative session, ma'am. Actually, nowadays it is required, actually, these kind of studies. Thank you, ma'am. Now I'll go for a feedback session, ma'am. Now I call Dr. Ramandeep, ma'am. Anything you wanted to add, ma'am?
Oh. Thank you. Thank you for calling me. A researcher presented very well, and her flow of manner is quite remarkable and quite, we can say, praiseworthy. And secondly, selection of the topic is again very good, very good. And thirdly, I can suggest the future scholars to
Yes, ma'am.
To the future scholars. We can say they can do the same study in the other areas of the India, and they can include more subjects to have more generalized findings.
Yes, ma'am. Yes, ma'am.
Yeah, but hats off to you. You have done really a very remarkable and very, very good work. Congratulations.
Thank you, ma'am.
Thank you, ma'am. Dr. Jyoti, ma'am, anything you wanted to add? Dr. Khanna, ma'am, anything you want to add, ma'am? Dr. Khanna, ma'am, anything you want to add? Dr. Ashia, ma'am, anything you want to add, ma'am?
Yeah, I would just like to say that as previously we discussed, that the more timing to be given to the mid of the state, we should consider part of it, the giving more time findings and so that will be more better, instead of going to the introduction and background and need for the studies and all. So methodology and the major findings has to be presented. The presentation was very good, appropriate, and because of and the technology, the death rate has reduced a lot. That we all
Yes, ma'am.
So previously, because of this problem, maternal death rate was very high.
Yes, ma'am.
See, to make it short, put more concentration on the main findings
Yes,
of the
ma'am.
research.
Yes, ma'am.
Okay,
Yes,
thank you
ma'am.
so
Thank you,
much.
ma'am.
Thank you for
Thank
that.
you, ma'am.
Congratulations. Thank you.
Thank you, ma'am. Thank you so much, ma'am. Khanna, ma'am, anything you wanted to add, ma'am?
No, I was just saying, being a labor and delivery nurse myself, and then the tutor as a faculty going with the students, it was like eye opener. They will not give much just to give a piece of it. They will just go to the C-sections. Quickly, they will see, no, we will go there. But you mentioned about the nurse practitioners. We have nurse midwives with the MSc background these days, and they are doing beautiful job. I don't know how they are manipulating, and there are very less lacerations than they used to be in the past. But very good and effective study, and your replica is wonderful and a welcome thing to do it.
Yes,
Wonderful.
ma'am. Thank you, ma'am. Thank you, ma'am. Thank you so much, ma'am.
Thank you,
Next,
Khanna, ma'am, and thank you, Anjali, ma'am. Thank you
we
for your.
have one more resource person.
Yeah, ma'am.
Yeah. Good morning, everyone. Very happy to join and listen to Madam Krishnan. Congratulations and best. I really like your topic, self instructional module.
Yes,
It's
ma'am.
very important. It's very important in each and every setting of labor ward or labor room or obstetric section. You know, it begins
Yes, ma'am.
right from antenatal period, how you prepare the mother during that period, not only at the time of on the table, you know. And
Yes, ma'am.
this perineal tear, you know, when I was a midwife in my KM hospital, Mumbai, perineal tear means it was a black hole. It was like, my God, how did it happen? Oh, I conducted the delivery, normal delivery, without perineal tear, without episiotomy, without forceps, without anything, because these things were not available that time. But nowadays, these primary mothers, when they go, they do not know anything, and immediately doctors wait for 7-8 hours and immediately say, no, there is cord around the neck and meconium stain is there, and they take it for cesarean section for the commercial purpose. But you can wait, prepare very nicely. You said that self-instructional module. The staff posted in labor area need to be educated in that, should have a good knowledge about midwifery, everything right from the beginning. You know, that is very important, because what happened in a government hospital or municipal hospital, every 2 years the staff is changed. Every
Yes,
3
ma'am.
years the staff is changed, and the new one does not know anything. And she doesn't teach also, and the one who goes to supervise there, the tutors, I mean, I'm very sorry if anybody is hurt, but tutors or whoever goes there as a supervisor do not go into the labor room. I've never seen. When
Yes,
I was teaching midwifery, I conducted the delivery in front of my student. What is ironing, you know, what is first stage of labor, what is second stage of labor. Then amniotic fluid was on my body, on my student's body. It happens. So if wearing apron, all those things are very important. You know, nowadays HIV mothers are also there. We deliver them. We don't discriminate them. You know, don't allow them. Only informed choice. Informed choice is there, and all this setup is there in city area, urban area. You know,
Yes,
doctor is
ma'am.
available, everything is available now. A lot of awareness is there because of digital things. But in rural area, you need to focus on rural area. Only knowledge or then getting this and presenting this. No, focus on rural area, because their trained eyes conduct the delivery better than the midwife in the hospital.
Yes, ma'am.
Home delivery, no tell, because she's been trained. She's been trained, she's been assisted by ANM, Asha Didis, you know, the Bachat group, and they conduct so nicely. When I used to take my students for community health nursing in PSC area, we used to see mothers delivering without a doctor, no doctor. Conducting delivery is a nurse job. No doctor is needed. It's a natural process.
Yes.
It's not a disease.
Yes.
Yes, ma'am.
Pregnancy is not a disease. It's a natural process. You know, the baby descends normally. Once the 9 month is over, even uterus doesn't want baby inside. Baby has to be thrown outside. Yeah.
Yes, ma'am.
So more focus on rural area. That is what is my
ma'am. Thank you.
appeal to everyone. But very good conduction, very good presentation, very
Thank
good
you, ma'am.
study, and all the points are covered very nicely. So I really appreciate you for presenting this paper, and thank you very much for giving me this opportunity to put my views forward. Thank you.
I would like to add something. You know that home deliveries are now limited. You know, 100% deliveries has to be conducted in the hospital.
Yeah.
In the
Yes.
villages, the primary health center and the sub centers and home deliveries were very popular. You know, around many years ago. But now, according to the health Ministry of Health, government, and we are saying family planning, they now want that 100% delivery should be conducted in the hospitals, whether it is district hospital or whether it is state level hospital, it has to be conducted in the hospital. So because of that, you know, now these complications have reduced quite a lot.
Quite a lot.
Quite a lot. We are not having now that much of problem, you know, when the deliveries were conducted at home by the thighs.
Yeah.
You know?
What is the MMR rate? Have you found out present MMR
Yes,
rate?
ma'am. Now it's 105 for 1 lakh populations. in India.
Yeah.
505 per
105 for 1 lakh
10.
population, ma'am.
So 105
Previously,
also
it's
has to come
383
down.
in around
Yeah.
2015 and
Yes.
16, ma'am. So now
Very
it's
nice,
reduced.
very nice.
Yes,
Reduced quite a lot,
yes, ma'am.
because of knowledge, awareness, and
Okay, sir, we need to move.
Okay, okay. Okay, ma'am. Thank you. Thank you so
Thank
much.
Okay,
you.
thank you
Thank
so
you.
much. Thank you.
Thank you,
It's
Now
ma'am.
we'll move on to
it's
third presenter.
eye-opening research.
Yes, ma'am.
Findings.
Yes,
Thank you,
ma'am.
ma'am. Thank
Yeah,
you so much.
Yes, ma'am.
yeah.
Thank you. Thank you,
Thank
Anjali
you.
ma'am. Thank you,
Thank you,
Asha
sir.
ma'am. Now we'll move on to third presenter, Professor Dr. Bhuvaneshwari Das ma'am. Dr. Bhuvaneshwari Das ma'am had completed her BSN MSN with Child Health Nursing, PhD in Nursing at Vinayaka Mission University, Salem, Tamil Nadu in the year of 2016. And she's also a complete master degree in sociology from Ravi Shankar Shukla University, Raipur, Chhattisgarh. Madam is currently working as associate professor and head of the Child Health Nursing Department at Government College of Nursing, Raigarh, Chhattisgarh. Madam has total 21 years of experience in teaching, diploma, undergraduate, postgraduate nursing classes, and 1.5 years of clinical experience. She has worked at various colleges as a faculty professor, vice principal, principal, and HOD of the Child Health Nursing Department and research coordinator. Madam has taught total most of nursing subject and is experienced in child health nursing, nursing research, basic biostatics for nurses. She is currently working as associate professor, head of the Department of Child Health Nursing, Government College of Nursing, Raigarh, Chhattisgarh. Madam has completed various certificate courses in nursing, informatics, leadership, bioethics, systematic review and meta-analysis, biostatics research, clinical simulation for health professionals, soft skills, palliative care, and introduction for forensic nursing sciences. She is a life member of Trade Nurses Association, joint secretary at NTI and Chhattisgarh branch, Nursing Scholar Society, SOMI, IAP, CNRS, NRSC, and so on. Now I call Professor Dr. Bhuvaneshwari Das ma'am to present her presentation. Over to you, ma'am.
Good morning, everyone, and a very good morning to everybody, and very good evening to Sukhanna madam, Asha Qureshi madam. And I'm very happy to present my thesis over here. First of all, I like to pay my gratitude to Sukhanna madam for inviting me and to continuously telling me that continuously asking me for present my thesis and to be the associated with the NNSS. Now I am associated with the NNS also. I'm very thank you to you, madam. And good morning to everyone present over here. So thank you, Sukhanna madam and NNSS family to providing me this opportunity to present my thesis over here today. And I like to say thank you to our today's evaluators also for evaluating our research and giving us valuable suggestions also. Thank you, madam. So with this quote, with this notes, I just like to share my screen and will present. Sir, are you going to share the screen, sir, or should I?
No, you can share it, ma'am. You can share it by yourself.
Thank you.
Not a problem.
Is it visible, sir?
Yes, ma'am. It is visible, ma'am.
Slide share, is it visible? Is it moving?
Yes, ma'am. It's moving, ma'am.
Okay. So,
thank you.
So the title of my study is Effectiveness of Pharmacological and Non-Pharmacological Intervention in Post-Operative Children among in post-operative management among children. So the statement of problem is a study to assess the effectiveness of pharmacological and non-pharmacological intervention on pain management among post-operative children in selected hospitals at Bhilai, Chhattisgarh. So as we know that pain is now as considered as fifth vital signs, and we were only considering the BP, temperature, pulse only, but now fifth pain also has to be considered, and that also to be recorded in our TPR sheet. So with that, thus pain is considered of fifth vital signs, requiring caregivers also regularly to assess the pain and address the pain also. Children's experience a similar kind of post-operative pain as adults, therefore should be subject to all methods of pain control. In healthcare, in health, the primary provider's role to assess and eliminate the pain by administering medication like pharmacological intervention, other treatment also like non-pharmacological intervention can be done like play therapy among the children based on the age group of the child. Then during the clinical posting of the investigator and myself, I had come across a lot of post-operative children and they were confined to bed, and found that they were confined to bed. Parents were not allowing them to play, thinking them it will be complicate the surgery and their recovery. And drug dependency during the hospitalization among the post-operative children also was there due to pain. Then if suppose we are giving some complementary therapy along with the medications, because ethically we cannot stop the medication. So along with the medications, suppose we are giving play therapy or some other complementary therapy that can reduce the pain of the child, or it can have some kind of remarkable pain management, then it will be cost effective also. So this motivated me to select the non-pharmacological intervention like play therapy as an intervention to reduce the pain among post-operative children admitted in this particular hospital. So the objectives of this study was to compare the pre-test and post-test in relation to non-pharmacological and pharmacological intervention among children in experimental group. Second objective is to compare the pre-test and post-test pain in relation to pharmacological intervention among children in control group. Third objective is to evaluate pain reduction between the children in the experimental and control group. Next one, to assess the influence of selected variables on pain reduction in experimental as well as in control group. The hypothesis stated for the above research statement is there was no significant difference between the pre and post-test pain score in relation to pharmacological intervention among the post-operative children in experimental group. There is no significant difference between the pre-test and post-test pain score in relation to pharmacological intervention among the post-operative children in control group. Third hypothesis is there is no significant difference on mean pain score between pre and post-test among post-operative children in experimental and control group. There is no significant association between the pain reduction and selected demographic variables of post-operative children in experimental and control group. So this was the review of literature on the above headings I have done, the selected headings I have done, and the emphasis was given based on the topic. So the review of literature was collected on the studies related to pain assessment scale in children. It was given like various pain assessment scale used for the children's using the UPAT, and YS found to be more effective. What is UPAT? That is Universal Pain Assessment Tool, and VAS is Visual Analog Scales. And next study says about the research literature related to pharmacological intervention on pain among post-operative children. And the emphasis has given on above this literature was pharmacological intervention like NSAIDs and opioids are given by the different routes to administer the pain management among the post-operative children. Another studies was emphasis on the literature related to non-pharmacological intervention on pain among children. Among this, many of the study has been conducted. I have taken six studies in that. The non-pharmacological intervention like play therapy, music therapy, guided imagery were used to be found more reduction in pain. So among that, I have chosen the play therapy. The other studies related to non-pharmacological intervention on pain among post-operative children. The 7 studies has been chosen on that. The non-pharmacological intervention like play and music therapy, audiovisual distraction were used for the pain reduction among the post-operative children. The other studies related to play therapy and pain among the post-operative children. The 8th study was found relevant, and in that, most of the studies revealed that play therapy on pain among the post-operative children was effective. And the other study says about the literature related to therapeutic use of play on pain. In that, 9 studies has been taken. Among that, the studies related to therapeutic use of play, it was useful in the reduction of play. Then other studies related to literature related to policies and protocols and standards of pain among the post-operative children was the policies and protocols and standards. In one study only I got in that, it has been some policies, protocols, standards for the management of pain among the post-operative children in all the healthcare agencies has been set so that we can reduce the pain among the children. So the conceptual framework was based on the Maljic and Ward pain gate control theory on pain. So the methodology was, for my study, was research approach and design was an experimental. It is a quantitative research design approach, and the experimental approach, it is experimental approach as well. Along with that, pre-test, post-test control group design with time series observation I have chosen here, rather having the only one observations. So the setting was Pandit Jawaharlal Nehru Hospital and Research Center, Bhilai. This is a 1,100 bedded hospital with multi-speciality and lost many of the surgery because we have got nice pediatric surgeons, and also many of the surgeries has been done here for the children. The sample size, was post-operative children admitted with the abdominal surgeries only I have taken. The sample size in the experimental group 200, in control group I have taken 200 samples. The sampling technique was used with simple random sampling technique. This is the research schematic presentation of research design. In that you can find the brief about the what I have done in the particular research. So in that is a very the important thing is you can see here there was a two group, experimental group and control group. And in experimental group, I have taken pre-test, that is from the O1 to O6, and here in the pre-test in the control group I have taken. Then in the experimental group, I have given the non-pharmacological intervention, that is play therapy. But in control group, I have given routine care along with, and both the group got the pharmacological intervention based on the prescriptions. Okay. So in the post-test, we can see here, post-operative pain score was done on in the different observations. So here, what did I do? Here I have chosen the morning and evening pain score I have taken for the consecutive first day, second day, third day, and fourth day, post-operative day. And every day, that means total I have got 5 days. So 4 days from the first day. So total I have taken, along with the pre-test, total 10 observations was there. But in the post-test, I have got 8 observations. So morning, this is O2. O2 is morning pain score in the experimental group, and O2 hyphen is that this one is the our evening pain score. So like that I have categorized, and you can see I have used the both universal pain scale assessment tool as well as visual analytics tool, because my sample age group was from these 4 years to 12 years. Previously, we have selected only, I thought of selecting only the school-going children. But later on, because I was seeing that most of the children was coming with the preschool children also. So later on, I have used 2 schools. So this was all this manipulation has been done by after the pilot study only. So based on the experts as well, and based on the pilot study, I have done this correction. I used two tools to assess the pain. So one is subjective tool and another one is objective objective tool. So visual analog scale is a subjective scale. So here the children can tell how much the pain score they have from 1 to 10 I have scored. I'll show you that later on. And in visual, this universal pain assessment tool is based on the expression of the child. We can assess how much the child is having pain. Same thing I have done in the post-test control group also post-test. Only thing, we have not given any kind of, you can say, intervention to this kind of children. But definitely, once my data collection is been over, then ethically the child also should not be deprived with the their routine, their interventions also. So intervention has been given to these kind of children also later on after collecting the post-test. So the data analysis and interpretation has been done by the descriptive and inferential statistics. And then we have got the pain. Then here in the criterion measure has been got it here, pain score. So the inclusion and exclusion criteria was, inclusion criteria was post-operative children who had undergone abdominal surgeries in the JLNH and RC Hospital, Bhilai, and children who were hospitalized for minimum 5 days after surgery, children and parents who were willing to participate in the study, because we cannot only ask for the children, we have to ask for the parents also. So the children who could understand and speak Hindi and English, children available during the period of data collections. Then exclusion criteria was children who were having complications after surgery, such as bleeding, shock, infection, and fever, children who were mentally challenged, and those who were not willing to participate. So the description of tool. The tool has been categorized into 3 sections. So first one is background variables. In that we have taken total 16 items were there, which was related to personal and health variables of the children. Verbal responses was obtained from the children and verified by with their mothers as well as caregivers regarding their age, gender, etc. Then this is the second assessment part, is that universal pain assessment tool I have used. This is the first one. You can see here this score from the 0 till 10, it ranges. This is what standardized tool which I have used it. And next one is visual analog scale. This I have developed based on the color code. So you can see the very light color 0, and we are going to the darker shades of the color, that is telling about the severity of the pain. So here the children, those who can read, write, and they understand. So the school going children, they can at least tell how much the pain they are getting. So we have to explain them the tool, and the children were able to tell about their pain score. Third one says about the play activities of the children. So there were 10 proposed play activity included with the instructions to play. The children had choice to play according to their choice. Why I have chosen this 10 proposed play? Because of the age group of the child, because 4 to 12 years we have chosen. So we have used many kinds of play. So they're like simple play I have used whatever the children are playing in that age group, like Ludo, Snake and Ladder, chess, okay, Chinese checkers, then painting, drawing, then writing, scribbling, all these things I have chosen for the children. So the validity of the tool has been done by the 9 experts, nursing experts, 3 pediatric surgeons, and 1 statistician. The reliability of the tool was done by the interview and observation schedule, and was established by the inter-rater reliability, and it has been established by the Cronbach Alpha. R was 0.995. The pilot study has been done in the Chandulal Chandrakar Memorial Hospital, Nehru-Nagar, Bhilai, and 40 post-operative children were selected for this by simple random technique, and it was done in the August to September 2011. Then the result of the pilot study was showed that the tool was feasible and practicable. The result, let us talk about the result and discussion. So this talks about I have not taken a lot of all the demographic variables because it takes a lot of time. So here we can say based on the play material used by the children. So you can see hospital material, very few children have used because hospital was not having their own play. Some of the children, they bring their own play materials in the hospital because children think that children will be bored up. So they bring. So here you can say, so this is what is experimental group, and this orange color is the control group. So you can see here only 22% from the control experimental group, they brought their own play material. But in the I have given in the control group as well as experimental group our play material also. Most of the children, they were not using their play materials in both the group. They were not at all playing play material with the play material. So this talks about the both, like they were having own play material as well as hospital play material. Then this was talk about the previous surgical intervention, because the children, those who had previous surgical intervention, they had some kind of insights, they have some kind of memories about their surgical intervention. So pain threshold also used to be increased in this kind of children. The research study says about that. So in experimental group, you can say here, most of the children, in 75% of the children, they had previous surgical intervention in this was then in experimental group, and 26% was there. They were not having any kind of, they were having surgical intervention, and 78% was not having any kind of previous experience in experimental group. In control group, 22% of children had previous surgical intervention and 78% of children was not having any kind of surgical interventions previously. So the first objective says about the pre and post test level of pain in relation to non-pharmacological intervention in the experimental group. So this is time series design. So you can say here from the day 1 till day 5, morning and evening pain we have been scored. So this is what is morning pain score. So you can see here. So you can check, this is the morning pain score. So you can say there is a drastic reduction of pain score from the day 1 till the day 5 in the experimental group. So you can see here, it was the more pain was there on the day 1, but it was drastically reduction of pain in the day 5. So the children's was experiences less, and definitely the healing of the wound also taken place. That also plays a major role. Then this was its evening day 1 to day 5 pain score among the experimental group. So here also there was a drastic pain. There is a drastic reduction of pain among the children from the day 1 to day 5. This was the using the visual analysis. This analysis was done using the universal pain assessment tool. And another one, this was using the the visual analog scale, because many of the studies says that both the scale has some kind of difference, and so that I have taken this two tool together. So here also, using this scales also, there was a reduction of pain from the day 1 to day 5, morning reduction, and evening pain reduction also from day 1 to day 5, there was a reduction of pain. You can see here. So the second objective says about pre and post test level
Ma'am,
of
on submission, ma'am, can you come to recommendations, ma'am? I think that would be better. I think we are
Can
running
you
with the
tell
time.
about the effectiveness of pharmacological and non-pharmacological, sir? So here you can see in this graph, there was a reduction in the UPAT and VAS, there was a little difference, but experimental and control group, there was a, you can see the difference. This blue color is experimental group, this is yellow one is the, this red one is the control group. So you can see the difference already here. So same way using the UPAT morning and evening score, same here we are using the in experimental and control group using VAS thing. So here you can check, here you can see about the your pre-test and post-test overall average pain score among the experimental and control group. So here the overall pain score in the experimental group was less. So same way here also using the UPAT scale. So this was the major findings. The major finding says that the reduction of morning pain score was significant as compared to the post-operative children day 2, day 3 and 4, because definitely morning was more comparatively other based on the level of significance was P was 0.001 respectively between the experimental and the control group. Same way happened in the evening pain score also. The reduction of the morning pain using the UPAT and VAS was significantly less in the experimental group compared to the control group between the day 2, day 3, day 4 and day 5 at level of 0.001 respectively. Then reduction of evening pain also was almost less. Then we can say I can conclude that complementary play activity with the play activities with pharmacological therapy found significant effect in the reduction of pain among the post-operative children. So these are some implications, like each hospital need to develop policies, protocols and standard for the post-operative pain management among children. In-service education programs should be conducted periodically for the nursing personnel and help the nurses to update their knowledge on non-pharmacological pain management among children. Some of the studies may be conducted to evaluate and usefulness of the various non-pharmacological interventions on post-operative pain management among children. A comparative study also can be conducted to observe the significant changes between the 2 or more non-pharmacological intervention like play therapy, music therapy, guided imagery, the audiovisual distraction on pain management among children. A study can be conducted to assess the knowledge of the nurses and parents regarding the non-pharmacological pain management among the children. So, sorry. So let me conclude this one. So the pre-test morning and evening pain score is higher than the post-test day 4 in experimental group, and the difference between the morning and evening pre-test and average pain score was 0.96 and 0.8 respectively using the UPAT scale. And same way using the VAS also have assist. So later on we can say the main conclusion of the study was the present study was assessing the effectiveness of pharmacological and non-pharmacological intervention in pain reduction among post-operative children. The non-pharmacological intervention, that is play therapy, which I have used here, was found to be effective on pain reduction. Pharmacological intervention was also effective. However, non-pharmacological 155 children non-pharmacological intervention play therapy was found to be more effective than the pharmacological intervention because both the groups received medication as per protocol. Therefore, proving play therapy augment the effectiveness of pain management among the post-operative children. So, complementary play therapy with the pharmacological intervention, pharmacological therapy found effective, significant effect in reduction of pain among the post-operative children. So, this was the recommendations we can say. I have some booklets I have prepared for the scope of this study for the teacher, for the staff, for the hospital, as well as the parents also can be used. So this is about the reference, and thank you so much to all of you.
Thank you, ma'am. Thank you for your wonderful study.
Beautiful.
There were many more, ma'am. I have cut short it because some of the reference.
Very good.
Thank you, ma'am.
Yeah.
Ma'am, we'll go for feedback now, ma'am.
Yes.
Dr. Ramandeep, ma'am, anything you wanted to add, ma'am?
Shall I stop sharing, sir?
Yeah, I'll take it now.
Thank you.
Ramandeep, ma'am.
Yeah, sure.
Yes, ma'am.
So
Please.
it is a very nice effect to know the new knowledge from the researchers from the each and every corner of India. I don't know either they are from the India or from the international level also, but really it is a very, very good effort. Few studies are having very good methodology, like the last one. The researcher adopted a time series design. Our nursing students, either from the MSc or from the PhD area, they are afraid of having such type of research designs. They are not using time series research design or even Solomon 4-ring design. So I think so this is a very good platform to get rid of their fear that they can
Exactly.
really. Yeah, sure. So they can really adopt new methodology to carry out the new researches. So I think so great thumbs up to the NSS team, to Madam Sukhanna, and to the other persons who are actively participating and organizing such fruitful events. Thank you very much for inviting me as a guest of honor for today's event.
Thank you, ma'am. Thank you for your blessing message. Asha, ma'am, anything you wanted to add, ma'am?
Yeah. Dear Bhuvneshwari ji, you have done a beautiful job, but you are only limited your study to the nurses and the parents, But here the doctor also needs to be involved because the medication order, they also should know that these occupational therapy and play therapy and music therapy, these are well-established studies are there, which I think because the moment the patient or child comes out from the surgery, the post-operative orders are written in the OT itself, That is mostly it happens that the post-operative orders and pharmacological orders are written in the operation theater only when the patient comes from the recovery room to the own ward and the nurse has to follow and give the injection. So this particular study needs to be, taken on the knowledge and knowledge assessment of doctors also, and they also should know that these type of studies are, it needs to be done. So most of the doctors are not no, we cannot convince them. So unless you will convince them, and unless your hospital will have the standing order protocol, that don't give the pharmacological therapy, in the operation theater, and let the play therapy and other therapies, play therapy, music therapy, occupational therapy, let that be taken care, and then only we can see that. So this very good study, but it has to be taken further, in a broader way. Thank you.
Thank you, ma'am.
Thank you, ma'am. Thank you, ma'am. Khanna, ma'am, anything you wanted to add, ma'am?
Meena wants to say something, Meena ji.
Khanna, ma'am. Yes, Meena, ma'am.
Yeah. First of all, congratulations and
Yes,
well done,
Meena, ma'am.
Bhuvaneshwari. I'm very happy that the way you have presented, you wanted more to give at this particular age. So I could understand your enthusiasm in presentation, And one more thing is a coincidence. Bhuvaneshwari, we had a TNI conference at your college, PJ Hospital, Bhilai, Chhattisgarh, in 2014 or 15, and I won 15, and I was a state SNA advisor, and I received first prize there at your institute. And we had many prizes, so we have a connection, somewhere connection. So I wanted to see, because I saw your hospital, your institute, and everybody was so well versed with everything. The presentation from your group was very nice. So from that group you are coming. So I really appreciate. And as Madam said, Asha Madam said, yeah, first of all, you have to involve them because pharmacology is done by them. and diversional therapy or alternative therapies are done by us. Doctor only write same treatment is there for post-operative patient. Antibiotic, painkiller, IV, polyethylene, this same thing is there. They write previous night only what is the post-operative management. So you have to, like Madam said, you have to include them also so that we can reduce pharmacological use by using diversional therapy, play therapy, music therapy, nowadays game therapy, storytelling therapy. There's so many things, you know. And in our hospital, social worker has kept a playroom, and whoever is giving toys, all the toys are kept there. All the walls are painted with Tom and Jerry, Doryman,
Yes, ma'am.
this, that. So saying there, Doryman, and even TV is there where
Yes,
continuously Tom and Jerry is going on, Doryman is going on, Murli, everything is going on. So that helps more, you know. They're interested in this audio visual aid.
Yes,
So
ma'am.
yes, very nice presentation. Thank you so much for
Thank
giving
you
me
so
this
much, ma'am. Thank you.
Thank you, ma'am.
I thank
Thank you,
you, Khanna madam. I thank you, Aisha madam. I thank you, Dr. Muttu, Dr. Khanna, Dr. Binu Jo, for allowing me to be here and every time intimating me and appreciating me and giving me an opportunity to give feedback. Thank you so much.
Thank you, Meena ji.
Thank you,
so
ma'am.
much.
Thank you so much, ma'am.
Stay till
Khanna ma'am, anything you wanted to add, ma'am?
no, stay till end. I am saying, Minaji, stay till end. We are doing the oath ceremony now. Quickly.
Yeah. Yes.
Ready?
Now it's a time to announcement of newly joined members by our beloved patron, ma'am, Khanna ma'am.
Okay.
Over to you, ma'am.
Binu sir should be ready. This month we did not have much in volume, but very type of members who are already jumping in to be our executives. How do you like it? Even in international chapter, which is we are going to inaugural induction ceremony on November 24th, all the credit goes to Dr. Asha ji, who has put day and night her effort to convince people to talk to them on phone or in person.
Yes.
And we just met 2 weeks ago and hugged each other so much that we will be on our mission. So thank you for each and every one of you to help us for moral support and everything with your presence also. So I will read the list. Mrs. Usha Rai happens to be sister also of Dr. Ashiaji, who is in Maryland, and she is our chapter president, Carnation, and number 27. We are going to open, and almost half work is done. But every minute, every day, we will be checking that we are ready for that. Then Mrs. Mary Parambil, she is from Canada and has joined and upgraded her membership to President Circle to be our one executive. Miss Molly Sam, many of you may be knowing her. She also joined us since she is from the editorial and she is given the responsibility as a co-chairperson of editorial board with Sudhaji, because Sudhaji is having a little problem in getting from chapters the summaries, the things. So we will be working hard. Then Dr. Arjun Singh Chaudhary, he promised that he will be active. This year he is in many projects. Dr. Kuntladare Hiren Parma, M. Jajuji, difficult for me to read. N. Pogu, Sandeep Kumar, Dr. Pratibha Chandekar, another example. She has taken already an executive position and also she is going to present in October her study. And then we have Chandra Deepti, one student. So congratulations to them and call upon Binu sir for reading the oath.
Yes, ma'am. Thank you. Now I call our beloved President, National President, Sir, Dr. Binu sir, for oath taking. Binu sir. Binu sir.
I think he is not here. I cannot see him in the list.
Yes, ma'am. We check, ma'am.
Okay, go to the oath. If Ashaji would like to read.
Yeah, you can just share the slide, Muthu.
Yes, ma'am. It is there, ma'am. Asha, ma'am, it is there, ma'am.
Oh, him
Okay. No, we can't see. Yeah, we can't see that. Yeah. Yes,
not.
It is not very clear.
No,
It's not very clear.
Madam, should I read?
It cannot be readable. Yes, you can read if you. Yeah, now I can. I think I can zoom it.
Yes,
a
ma'am.
little.
Please.
Yeah. I solemnly pledge my allegiance to the society that I will be abiding the rules and regulations of this honorable society. I will discharge my duties and bear the responsibilities as an office bearer. I will carry on my responsibility member. I will be responsible member and not give any statement to media or to anyone. I will function as a part of the society and not solo to promote my agenda or business. I pledge in front of Almighty and this general body to uphold the nursing professional standard and protect and project the honorable image of my profession. I do.
I do. One more, ma'am. Asha. Pledge of all of them, ma'am.
Yes, I do.
I do.
Kanna, ma'am.
Wonderful. Go to vote of thanks slide, please. Next slide.
Vote of, ma'am, will directly go for vote of thanks, ma'am.
It's always hard to say goodbye when we all want to enjoy each other's company to the longest time. But the reality is different. We need to get back to our commitments and responsibilities. My sincere thanks to our chief guest person, Ramandeep ji, guests of honor and special guests, Ashia ji, Meena ji, and our founding president, organizing team, presenters, audience, and our lovely students. Last but not least, to our both masters of ceremony, they have done marvelous job to keep the program going smoothly. Additionally, thanks to Professor Dr. Muttu sir for developing a colorful PPT. Thank you all. Best wishes and God's blessings. And to you all, good morning. Have a nice day. And to me, good night.
Good night, ma'am. Good
Me
night.
Thank you,
also
ma'am.
good night.